This might be a question now because nowadays they are focusing on the infection control purposes. So you need to have a general idea regarding them, that what they are and how you define them and what all you can do to reduce this particular burden of the infection in the hospital. Okay, so these particular infections which we are talking about, they are being classified into what? They are being classified into COTY. Okay, and what is the full form of COTY? That is the catheter associated UTI. Then you have CRBSI, and that is termed as what? Catheter related bloodstream infection. Okay, the third name is VAP, which we have already discussed up, that is ventilator associated pneumonia in the LRTI chapter. Then you have the surgical site infections. This also is one of the predominant infection which is found in the hospital. Okay, so these are the various infections which are found in the hospitals, right from the COTY, CRBSI, that is the catheter related bloodstream infection, catheter associated UTI, ventilator associated pneumonia, and the surgical site infections. Okay, so we'll discuss them one by one. First of all, regarding the nosocomial infection, as you already know, the nosocomial is defined by the time period that after 2 days of hospital admission, if anybody develops up any sort of infection, okay, that particular infection is termed as what? That infection is termed as nosocomial one. Okay, and I already discussed up that mainly 4 types. One is COTY, one is CRBSI, one is ventilator associated pneumonia, one is surgical site infections. Okay, so one by one we'll talk about them, and firstly we'll talk about this COTY only. What is this COTY? This COTY is the most common HAI, that is hospital acquired infection, worldwide. Okay, this particular one is the most common hospital acquired infection worldwide. Okay, and obviously it happens due to what? The indwelling urinary catheter which is being put. That is the main agent which leads to this particular COTY. Okay, so basically more the catheter is being for the more days if it is being put, more it will lead to what? These type COTY episodes. Fine. So first of all, you need to look out this thing, that if it is a short-term catheterization, then which all organisms are involved, and if it is a long-term one, then which all organisms are involved. Okay, so that's a common sense that in the short-term catheters ones, the most common, as you know, is what? E. coli. Okay, along with the E. coli, the friends of it like Klebsiella, and certain non-fermenters like whom? Pseudomonas. So these all, they are important ones in the short term. Besides this, don't forget this particular name, that is the enterococci, which is what? Which is a GPC, and this also associates with the nosocomial infection, that is COTY. Okay, and this question can come. Okay, this particular question can come, and they can form up a particular framework by putting up the culture media name, bile-acetylene agar and all that stuff, and they can ask you that which is this organism. So answer is enterococcus also associates with what? That is the COTY. And I am telling up these organism name in what? Short-term catheterization. Now, if a particular patient is being catheterized for a very long time, okay, so long-term one, in this, mostly the organism which are turn out in the nosocomial setup is polymicrobial. Okay, in this particular one, they turn out to be what? The polymicrobial, and the pathogens which are there in the short one, they are there itself. Along with them, these 3, they also add up. And what is the 3 names? PMP, that is the Proteus, Morganella, okay, and Providentia. These are the 3 names which adds upon to this short-term list, that is PMP. Along with that, E. coli, those Klebsiella, Enterobacter, Pseudomonas, okay, along with that Enterococcus and PMP also, Proteus, Morganella and Providentia. Fine. Now, how does this infection happens off. Okay, so obviously two things are there. One is extraluminal spread outside the lumen, and another one is intraluminal spread, that is inside the lumen. Okay, so extraluminal one, that is mostly deals up with what? The endogenous flora. Okay, endogenous flora of that particular patient, or it is being gifted by whom? The soiled hands or dirty hands of whom? Healthcare workers. Okay, so that is one of the reasons for this extraluminal one. And for the intraluminal one, it is the drainage system. Okay, there might be an open drainage bag which allows the organisms to enter up and leads to the infection. So that is the intraluminal spread. Extraluminal is with endogenous and the hands of the healthcare worker, they can promote up, and intra one, it is due to the open drainage bag. Okay, now this particular COTY is being diagnosed up by a particular criteria, and that criteria you can remember by this particular table. What are the various criterias to diagnose up the COTY? And in this particular criterias, the three criterias are important for the diagnosis of this particular COTY. The first one is that the patient is being catheterized and there is a history of this recent catheterization within 48 hours. This is important. Okay, the clinical criteria, at least one sign or symptoms of UTI developed, like fever, suprapubic tenderness, costovertebral angle pain, urgency, frequency, dysuria, which you can remember by this FUD. And if we go for the urine culture stuff, in that there is a presence of significant bacteria defined as colony count more than equal to 3 CFU per ml in the symptomatic patients, and more than equal to 5 CFU per ml in asymptomatic patients. This particular thing is diagnosed as what? COTY. That is the catheter associated UTI. Okay, so this you need to focus upon in this. Now talking about the CRBSI, that is catheter related bloodstream infections. Okay, now basically it associates with what? The central venous line. Okay, or you can call it as central line. Okay, so you have put what? Central venous catheter, and you can also call it as what? A central line is being put. Okay, so this particular one, that is the central venous catheter or the central line, that is being like divided up into two things, that is the temporary one and the permanent one. Okay, temporary one and one is permanent one. Temporary one is what? That is the short term one, and this particular short term is being defined as less than 72 hours. Means if you are putting up this for less than 72 hours, this is termed as temporary or short term. The permanent or long term, that is being defined as more than 72 hours. More than 72 hours, that is being defined as a permanent one. And from where you insert it, what is the site of insertion of these particular central lines? The site of insertions are the subclavian. Okay, one of them. Then the femoral can be there. Internal jugular and peripheral veins, they can be involved up in using up this. So these are the various sites of insertion: subclavian, femoral and internal jugular one mainly. Okay, then this particular one, how does the infection happens here? Okay, organisms gain the entry. Organisms gain the entry due to the colonization. Okay, they gain the entry due to the colonization of the organism by basically colonization of the organism on central line. Okay, those particular ones like corns, sometimes staph aureus, so they like colonize up the central line and all if all the precautions are not taken properly. And as you know that this can produce what? This can produce even the biofilms, okay, and they get adhered up to that particular surface. Fine. Now if somebody asks you that what is the clinical criteria, okay, what is the clinical criteria for this catheter related bloodstream infection? So the criteria is that there is a presence of fever, chills, okay, fever, chills and rigor along with hypotension, okay, fevers, chills and rigors along with hypertension after central line is used. Okay, that particular episode happens after what? The central line is used, and there are signs of this catheter site infection also. Okay, the signs are there, like there is erythema, okay, there is tenderness at the insertion site or the catheter exit site. Okay, so there is erythema, tenderness, swelling at the catheter exit site. Fine. So basically it is defined by two things, like either it is the presence of fever, chills and rigors, hypotension after the CL is being, like central line is being used, or the signs of catheter site infection like erythema, tenderness, swelling at the catheter exit site. That is the clinical criteria. And what about the microbiological criteria? What is there in the microbiological criteria? In the microbiological criteria, what you have to remember is that you will go for blood culture. Okay, you will go for what? Blood culture from the central line and from the peripheral line. From both you will go for the blood cultures, and the central line blood culture bottle, okay, that flags means turns out, gives a signal, okay, that flags more than or equal to 2 hours prior to the peripheral line blood culture bottle, okay, then it is termed as a central line or catheter related bloodstream infection. Okay, so this will be termed as this, that is a central line or catheter related bloodstream infection. So this is a microbiological criteria, means you have taken the blood culture from the central line blood obviously and from the peripheral line, and the central line one flags more than or equal to 2 hours before to the peripheral line one, then it is short a case of what? CRBSI. Okay, so this also needs to be focused. Fine. Talking about the VAP. And VAP is what? Ventilator associated pneumonia. Remember, this is the second most common nosocomial infection after the COTY. Okay, this is the second most common nosocomial infection after the catheter associated UTI, and it accounts for 15 to 20% of the total hospital acquired infections. Okay, this accounts for how much? 15 to 20% of the total HAIs, and most common cause of death. Okay, most common cause of death among the HAIs, the stigma goes to these VAP only. and the mortality rate is around 40% because of it. Okay, so that is also to be focused upon. Now here comes in this one termed as early onset VAP and one termed as a late onset VAP. Early onset VAP, this particular one occurs in first 4 days of mechanical ventilation. Okay, this occurs in first 4 days of mechanical ventilation and typically caused by the community ones, that is like pneumococcus. Okay, because that is the most common cause of community acquired pneumonia, that is the CAP. Then you have Haemophilus influenzae in this early onset VAP, and you have even MSSA, that is methicillin sensitive Staph aureus. So this I am talking about what? Early onset VAP. And then there is an entity termed as what? Late onset VAP. And the late onset VAP develops more than or equal to 5 days after, okay, the mechanical ventilation start. Okay, and in this mostly the drug resistant one they are involved, like Pseudomonas aeruginosa. Okay, now who will come for the meeting? Those who are dreaded ones, like Pseudomonas aeruginosa, the brother of it, that is the Acinetobacter baumannii, okay, which is as per the WHO has been characterized as organism to be looked out for. Okay, its critical importance have increased up. Then their brothers like E. coli, Klebsiella also you can get off, but mostly in what? In the late onset VAP. And here also there might be entry of whom? MRSA, methicillin resistant Staph aureus. And what can be the source of these infections which we are talking about, the early onset VAP and the late onset VAP? The source is everywhere. The source is what? It can be the endogenous one, that is the patient itself on flora, or it can be a gift from whom? It can be a gift from the hospital authorities or hospital environment. Okay, so that is also one of the important ones to be focused upon. Regarding the VAP, that is very true that because of that endotracheal intubation and all, and because of sedation, along with that the supine position, these all things definitely makes an environment conducive for doing what? Ventilator associated pneumonia. Okay, as I've already told you that there is a score here which I've like discussed off in the LRTI stuff, that is termed as CPIS score. Okay, and this particular CPIS score of more than 6 is diagnostic of VAP. Okay, this is diagnostic of VAP. So this also you needs to focus upon, that we go for a infection score here, and that particular infection score is termed as what? CPIS score. And if this comes out to be more than 6, which I've already discussed up, okay, so which is having a number of things in it discussed off. Okay, so CPI score of more than 6, this particular thing is diagnostic of what? That is the VAP. Okay, otherwise as per the microbiological criteria which is concerned, in the case of VAP, what you can do, you can go for certain specimens, like you can go for the ETA, endotracheal aspirate. Most common is this only which is being used, along with the BAL, that is bronchoalveolar lavage fluid. You can do by the bronchoscopy what? The lung biopsy also. Okay, then the first and the most important, you can go for the gram staining, and you can find out that which particular flora is coming off. And definitely you can go for what? The culture, and the significant or the like significant amount that is being termed as quantitative assessment. That particular quantitative assessment is what? More than equal to 10⁵ CFU per ml. Again the same like in the urine. Here also for the this particular ETA, that is the endotracheal aspirate. Fine. It is being said that more than equal to 10 to the power 4 for the BAL, that is there. Okay. And this is the quantitative one. And in the semi-quantitative one, you can just estimate of what? Moderate to heavy growth if it is coming off. That is more or like suggestive heavy, you can say. Moderate to heavy growth. If this is being told up, you can see on the plates now, this moderate to heavy growth, then that also will give you an idea regarding the VAP. Okay. So that is there. Other than that, you can go for your radiological investigations like CT, okay, CT scan or the chest X-ray. They can also play a role in diagnosing what? That is the VAP. Okay. So these all things are there regarding the VAP. I've already discussed fully the CPI score also, and that you can see up in which particular section in the LRTI one. Now, talking about the last here, that is the surgical site infection. Regarding the surgical site infection, so surgical site infections are those particular ones which develop within 30 days of surgery. Okay, they develop within 30 days of surgery. Fine. Where? At the surgical site. So that is termed as surgical site infections. But there is an exception, and those exceptions can definitely be asked, and these exceptions are for whom? It is for the breast, it is for the cardiac, and it is for the joint surgeries. For them, this particular time period is 90 days, not the 30 days. Okay, so this also needs to focus upon that 90 days after in these surgeries is termed as what? Surgical site infections. Otherwise, it has been defined as what? Within 30 days of the surgery at the surgical sites, if some infection happens up, that is surgical site one. And the same story for this also, that the patient might be itself a source, that is the endogenous one, and the patient might get a gift from the healthcare worker or from the environment of the hospital, that is the exogenous one. Okay, so these all particular important points you need to remember regarding the surgical site infections. Now here only I like to tell you the various types of the wound class types. Okay, so what are the various? The wounds class type, because on this also the question have come once. So just a idea that which all types of wound class types are there. So class 1 wounds, the class 1, they are which one? That is the clean wound. Okay, these are which one? Which are the clean wounds. And the class 2, they are the clean contaminated wound. Clean contaminated wound. Okay, and in this means you enter the body organs under the controlled conditions, that is termed as clean contaminated wound. Okay, then the class 3 is which one? Contaminated. Okay, the class 3 is what? The contaminated wound. And when it will be contaminated, any accidental wound is there, or if there is any major break in the sterile techniques which you are following off, that will lead to this contaminated wound. So contaminated wound mostly you remember associates with what? Accidents and all. Okay, it associates with what? Accidents and all. And there is one more class, that is of dirty and infected wound, which comes under this class 3 only. Okay, class 3 only. And in this, what is there? The surgical procedure is done. Surgical procedure, this particular one is done in them when active infection was there. Okay, already means it was having an infection and it was being operated. So that particular thing leads to what? Dirty or infection wound, you call it. Dirty or infection wound, you call it, means it is that particular site that like where already the active infection is there and you have done the surgery. So that is termed as dirty or infection wound. This also comes in the class 3. Again, I'm telling up, the class 1 is a clean wound, class 2 is a clean contaminated wound, class 3 is a contaminated one, mostly the accident related, and another one is a dirty infection wound. That happens when already the active infection is there and you have done the surgery at that particular site. Okay, so these are there. Other than that, the other classification of surgical site infection you can remember is superficial SSI and the deep SSI. So as the name suggests, that is at the level of superficial incisional site. Superficial, okay, superficial incisional site, that particular thing is termed as superficial SSI. Okay, means what is involved up? Skin and the subcutaneous tissue in this particular one. And in how many days it happened? Within the 30 days. Okay, and another one is deep SSIs, that is at the level of deep incisional site. Okay, at the level of what? Deep incisional site. This particular deep SSI is there, that is at the level of muscle and the fascia. Okay, that particular one, that is involved up in the deep SSI, and this is also within 30 days of surgery. That is termed as this. Okay, the exception to this particular rule is the same, that is the breast one, okay, the cardiac one, or some implant surgery. Okay, joint implant surgeries, they are in the exceptions, because for them it is being defined as what? More than 90 days. Okay, for them it is defined as what? 90 days, not the typical 30 days is there for these particular surgeries. Okay, now just for the information sake, I will tell you that how to go for the prevention of surgical site infection. Okay, how to go for the prevention of surgical site infection by the common sense. And what is the common sense? That first one is you go for pre-operative bathing. That will help in prevention of SSIs. Second one is you treat up the MRSA carriers with mupricin ointment. Okay, another question which is being asked in the recent exams, that the MRSA carriers, they are treated up to make them free with what? The answer is mupricin ointment. This can be given to the patient and to the healthcare worker also if they are having this MRSA. Okay, another thing is hair removal. And in this, the special thing, interesting thing is that shaving is not to be done. You have to remove the hair with a clipper, if at all you have to. Otherwise, no need to be done. So hair removal should not be done. Okay, so this is against the traditional belief that we should go for the hair removal of the surgical site. They will reduce the infection. No, it is not so. You should not do the hair removal. If at all it is necessary only, then you have to clip it up. You should not shave it. Very important point. Okay, so these are the various steps which you can follow up for the prevention of surgical site infection. And certain steps you can do when you are doing the surgery. Okay, that is the intraoperative measures. The first one is SAP, that is systemic antibiotic prophylaxis, that is being given off properly. Okay, so basically the antibiotic prophylaxis will prevent up these types of offshoots of these particular infections, so that should be given up properly. The surgeon should go for surgical hand disinfection by the best possible ways. Okay, so that is also one of the way. Then that surgical site preparation, that should be done properly. Surgical site preparation, okay, means you should use the proper chlorhexidine and all that stuff. And within that particular one, there should be oxygenation proper. Okay, oxygenation proper means you maintaining up all the like FiO2. FiO2 is said to be around 80%. Okay, that should be your target to achieve up this oxygenation proper. Okay, Along with this, the anesthesia fellows, they also maintain a what? The normal blood glucose levels. Okay, normal blood glucose levels during the surgery, and that the ideal one, that definitely should not be more than what? 200 mg per dl. The target level is this. Okay, the nutritional support that everybody gives and all. So all these things, they are not having anything related with the surgical site, but still they also play a role in prevention of what? Surgical site infection. Okay, so that is there. The proper drips which you are like putting off, the proper oxygenation, the target is this one in this, and a normal blood glucose level as such. But if at all, you have to maintain it below 200. Okay, so that is there. This is intraoperative one. Now talking about the post-operative one. Post-op. In the post-op, the foremost thing is the proper wound dressing. Okay, the foremost thing is what? The proper wound dressing, and that should be done when? Daily properly with the proper antibiotics and antiseptics. You have to do the proper wound dressing. Okay, fine. Then after the operation and all, this should be your like idealism to disinfect the OT with a high level disinfectant. Okay, you have to monitor up the particle count in your OT. So periodic monitoring of the air quality, that is also there to be observed up. Settle plate count and all that is done. And if you manage up all these points in your OT regularly, that you go for these all settle plate cultures, for the periodic monitoring of the air quality, or for these particular various, you're doing up the OT disinfection with the proper high level disinfectants and all, and the wound dressing is being done properly with the proper antiseptics and the antibiotics, then definitely these surgical site infections, they are being reduced to a minimum. They will not be eliminated, but definitely they will be reduced to a minimum. So these are the various important nosocomial infections which you have to focus upon, because the questions will be coming on them, and you need to remember their definitions also, that early onset VAP is what, late onset VAP is what, surgical site infections, superficial one, deep one, what is the most common one, COTI. Okay, what is the second one, that is a VAP. Okay, what about the catheter related BSI? What is the criteria microbiologically? They can ask you which all samples are involved up in causing up in the VAP and all, which criteria is followed, a CPI score more than how much, more than 6, that is diagnostic of VAP. Okay, otherwise you can go for the microbiological criteria, you can go for the cultures and all from this BAL. Okay, and from all those fluids which you can have, you can do the culture and all. The same thing in this surgical site infections also. Less than 30 days, like if you are having an infection after the surgery, that is there, and around 90 days in the important ones, like which one, like in the cardiac ones, in the implant ones. Okay, so those particular like breast surgeries and all, in them it is around 90 days. And these all particular steps I have already told you, intraoperative one, pre-operative ones, and the post-operative ones, which definitely helps in reducing what, the various surgical site infections. Okay guys, so if you remember all these particular ones, definitely 1 or 2 questions is there in the exam, which will like definitely make it worth to read all these particular infections. That is nosocomial one. Now what is definition nosocomial one? After 2 days of like admission in a hospital, if somebody develops an infection, that is termed as what? Nosocomial. Another question which is being asked. Thank you so much.